Hello everybody. So welcome to Deeksha Online. We were discussing about the chapter Reproductive Health. So in this class, we will be discussing about the next lecture, that is lecture 2 in Reproductive Health. To give you the chapter overview or the roadmap of this chapter, in this chapter we will be dealing with reproductive health problems and strategies, population stabilization or dealing with population explosion and birth control, medical termination of pregnancy, that is MTP, sexually transmitted infections, as well as, last but not the least, infertility. So let us go through a quick review of what we have learnt in the previous lecture. In the previous lecture, we have learnt about the meaning of reproductive health, isn't it? According to World Health Organization, we have learnt about India's efforts towards attaining reproductive health, like what are some of the measures that were implemented by the government, that were planned by the government. It is planning is not just important, implementation is important. We had also learnt about what are the various requirements to implement these programs. We then learnt about the population explosion, what are the various steps and how to encourage couples in order to follow the one child norm and providing incentives to them and creating awareness about birth control options. All this would go a long way in bringing a check on population explosion. Then we had moved on to focusing specifically on contraceptive methods, which is the birth control methods. In this, we had discussed about the natural methods of birth control, isn't it? Now we will be further discussing in today's lecture what are the other methods of birth control or contraceptives. So moving on with today's lecture, the second type of birth control methods is referred to as the barrier methods. Now, what is a barrier? A barrier is an obstruction. So you are creating an obstruction between whom? Between the ovum and the sperm. By creating an obstruction between the ovum and the sperm, you are not allowing them to physically meet each other. So this is the working principle behind the barrier methods. Please note, all of you, this is a very important question in your board exam. They may ask you the working principle behind the barrier methods. It's very simple. A barrier is an obstruction. It's a blockage. So you are blocking the sperm and the ovum from meeting each other, from physically meeting each other. You are creating a barrier. You are using certain devices to create this barrier. In barrier methods, we will be focusing on two types. One is referred to as the condom or the sheath, and the second one is used exclusively in females, that is diaphragm, cervical caps, and vaults. So moving on to the first type of barrier method. The first type of barrier method is referred to as the condom or the sheath. It is made up of a thin rubber or latex sheath. Remember, it is used by both the male as well as the female. In case of male, it is used to cover the penis. In case of female, it is placed or it is inserted into the vagina and the cervix. Not the cervix actually, it is inserted into the vaginal canal. It's a tube-like structure made up of thin rubber and latex which is lodged inside, which is inserted into the vagina. So remember, it is used by both male and female. In an attempt to bring about a reproductively healthy society, to combat the stigma associated with the reproductive or sex related aspects, the government had undertaken a program where it distributed free condoms for males, and the name of the condom distributed was the Nirodh. They are disposable, condoms are disposable, and they can be self administered without any medical supervision. Another very important advantage is they offer protection against some of the deadliest sexually transmitted diseases, including HIV, that is AIDS. Okay, so this is the advantage, that is, it offers protection against sexually transmitted diseases. So you can see here, this is the picture of the condom for male, and this is the tube-like structure made up of rubber or latex, and this is the condom for female. So as mentioned, it is used in both male and female. The next one is called a diaphragm or a cervical cap or a vault. A diaphragm or a cervical cap or a vault, as you can see here in this image, it is a thin, flexible, dome-shaped structure, again made up of rubber. So you can see how it is dome-shaped or a small cup-like structure. It is made up of very thin rubber. And remember, all these devices are used only by women, not by men. So this is specifically for women or females. It is inserted into the vagina and positioned over the cervix just before the coitus. So it acts as a block. It's placed inside the vagina. It will not allow the sperm to enter into the cervix because it blocks the entry to the cervix. So what are we accomplishing here? We are creating a barrier. We are creating a blockage so that the sperm cannot meet the ovum. They prevent conception by blocking the entry of the sperm into the cervix. And they are reusable. Of course, a lot of hygiene has to be maintained and therefore they are reusable. So let us see how the diaphragms or the cervical caps are placed. So here you can see a cervical cap and notice how it is closely fitted into the cervix, isn't it? It sits as a cap very snugly fitted on the cervix, and obviously here when the sperms are liberated into the vaginal canal, they are blocked over here, they cannot enter into the cervix. The only difference, and usually cervical caps and vaults are used interchangeably, and diaphragm is a broader structure. It is much more bigger dome shaped structure in comparison to cervical caps. Okay, now as you can see here, the cervical cap or vault, it fits very closely to the cervix of the uterus, the neck of the uterus. It prevents the entry of the sperm into the cervix. However, if you see a diaphragm, it is a much broader structure that is fit in the vaginal upper part of the vaginal canal like this. It doesn't fit closely to the cervix. If it fits closely to the cervix, it is a cervical cap. If it is placed in the upper part of the vaginal canal, and if it is a broader disc-like structure or a cap-like structure, then we refer to it as a diaphragm. Okay, so here you can see how it is a structure made up of flexible thin rubber. It acts as a barrier. It blocks the entry of the sperm into the female, that is into the cervix, and thus it prevents the process of fertilization. Clear? Now moving on to the next type of birth control methods, which is referred to as intrauterine devices. Intra means within, uterine means uterus, and device is a device which is implanted where it is placed inside the uterus. That's why these are referred to as intrauterine devices. This picture excellently depicts what an intrauterine device looks like. As you can see here, the device is looking like a T-shaped structure, an alphabet T, isn't it? And see how it is placed inside the cavity of the uterus. It has to be inserted through the vaginal canal, through the cervix, and then it is placed inside the vagina. So obviously this has to be done by a doctor or an expert nurse. The woman cannot insert the structure on her own. And these are devices again which are employed specifically in women, obviously because the name itself indicates it is intrauterine. See how it is placed here, it is sitting inside the uterus, and like I said, it needs to be inserted through the vagina and through the cervix, and as a result one cannot do it on herself, all by herself. It requires the help of a doctor or an expert nurse. Okay, so this is what is referred to as an intrauterine device. What are the different types of intrauterine devices? Intrauterine devices may be of three types, a very important 3-mark question in your board exam. Mention the types of intrauterine devices along with suitable examples. So we have the non-medicated intrauterine devices, for example, lipase loop. Non-medicated means it just sits in the uterus, it doesn't release any chemical. Then how does it work? How does it prevent conception? That we are yet to discuss. So remember that non-medicated means it does not release any chemicals. Then we have copper releasing IUD. These IUDs sit inside the uterus and they are basically wound with a copper wire which slowly dissolves and releases copper ions inside the uterus. Since they release copper, they are called copper releasing IUDs. For example, we have copper T, copper 7 and multi-load 375. The third category of intrauterine devices is referred to as hormone releasing IUDs. That means these IUDs in the uterus, they have a hormone vial, they have a vial containing a hormone pill or a hormone releasing instrument or a device in them. So slowly they release hormones into the uterus, which is absorbed into the bloodstream of the female. Okay, so these hormone releasing IUDs, example is Progestisert and LNG-20. So this is to give you an idea of what are the different types of intrauterine devices and their respective examples. So remember, they are non-medicated, they are copper releasing, and they may release hormones. That's why they are called hormone releasing IUDs. Okay, now let us see how these IUDs work. I was telling you about non-medicated. Generally, the first point is common for all of the IUDs. Now, first of all, it's a foreign substance sitting inside the uterus. It will irritate the lining of the uterus, and when it irritates the lining of the uterus will start producing WBCs on its surface, phagocytes on its surface. And what will these phagocytes do? The phagocytes will start eating up the sperm. So IUDs increase the rate of phagocytosis of the sperm in the uterus. Remember that it is a foreign body that is sitting inside the uterus, so it causes some irritation to the lining of the uterus, and the lining of the uterus will start accumulating WBCs. It will start producing WBCs. As you know, WBCs are phagocytes, and so when the sperm, if they are traveling up the uterine lining, they get phagocytized, they get destroyed. So this is how an IUD typically works. It increases the phagocytosis of the sperm, and if the sperm are killed, there is no question of fertilization, isn't it? Then the copper releasing IUDs. Now we saw that they mostly have a copper wire wound around them, and the copper wire releases these copper ions. What does the copper ion do? The copper ion is somewhat toxic to the sperm because it suppresses the sperm motility. The sperm becomes slow. When the sperm are released into the female reproductive tract inside the uterus, because there is an IUD sitting inside and because it is releasing copper, the sperm becomes slow. As well as the sperm lose their ability to fertilize the egg. There is a suppression in both sperm motility as well as in the fertilizing capacity of the sperm. So remember, copper ions suppress the sperm motility and the fertilizing capacity of the sperm. How do hormone releasing IUDs work? They make the endometrium or the uterus unsuitable for what? Implantation. They make the uterine lining very, very thin. If the uterine lining is very, very thin, then obviously even if there is zygote formation and embryo formation, implantation cannot happen. So it makes the uterus unsuitable for implantation. It also makes the cervix dangerous or hostile to the sperm, unfavorable to the sperm. So it alters the environment in the cervix. Obviously the sperm has to cross the cervix to reach the uterus. Because of the IUD, the cervix is made hostile and the sperm get killed when they are passing through the cervix. Did you understand the mechanism of action? All this is 1 mark question, or the whole thing can be asked as a 3 mark question. How do IUDs work? So remember that they induce phagocytosis. Copper ions released by copper releasing IUDs suppress the sperm motility and the fertilizing capacity of the sperm. Hormone releasing IUDs make the uterus unsuitable for implantation and they kill the sperm in the cervix by making the cervix hostile to the sperm. Okay? So this is a lipase loop, the non-medicated IUD that I was discussing, isn't it? So it is called non-medicated because it does not have any active principle. It does not release any chemicals inside the uterus. Now this T-shaped structure is the copper T, and you can see copper wire is wound around it, and the copper wire will slowly release the copper ions. Like we saw, it suppresses the sperm motility and fertilizing capacity of the sperm. And this is the hormone releasing. See, there is a vial, there's a metallic vial. Inside this vial a capsule is placed, which will slowly dissolve to release hormones. And we saw that the hormone releasing IUD works by altering or by making the cervix hostile to the sperm and by making the uterus unsuitable for implantation. Now in the NCRT they have given the image of a copper releasing IUD. See, T-shaped structure with a wound copper wire, and these are the threads which are suspended from the cervical region, so that after the woman or when the woman desires to conceive, it can be removed, it can be pulled out using this thread. Okay, so this is what an intrauterine device looks like. So remember, these are used exclusively by women, and these need to be inserted all the way up into the uterus through the vagina. So one needs a supervision of a doctor or an expert nurse. Okay. Next, the fourth type of birth control methods, which is called the chemical methods. Now in the NCRT it is simply called the chemical methods. We can also call it as pharmacological methods because it involves intervention of chemicals or use of certain drugs, active chemicals. What are the different chemical methods of contraception? Now the various chemical methods of contraception include oral pills, which are consumed orally. Then it may include injectable, where the drug is injected into the body, either underneath the skin, underneath the muscle, or directly into the bloodstream. Implantation, where certain small devices are implanted underneath the skin and they last for a very long duration. Their effective periods are much longer when compared to the oral pill. Then we have the spermicidal cream or spermicidal jelly or spermicidal foam. So these are the three different types of pharmacological or chemical interventions or chemical methods of birth control. We shall be discussing each one of this one by one in detail, and let us see how they work. The first one is called oral pill or oral contraception. As the name itself indicates, these are capsules or tablets which are administered orally. They are taken orally by the woman. Of course, now recent research is being done as to create oral pill for the male also, which has something to do with the sperm life or with something which alters the composition of the semen. But here in this chapter, we are going to talk about only those which are used by women, the most widely used oral contraceptive or oral pill which is used by women. They may contain only progestogens, which is progesterone family of hormones, or they may be a combined pill. If it has progesterone only, then it is called a mini pill. If it has both progestogen and estrogen combination, it is referred to as a combined pill. So two types of oral pills which are taken by females. One is it is progestogen only. Second one is progestogen estrogen combined pills. They are taken in the form of capsules or in the form of tablets by women. They need to be taken regularly. This is a very important point because if there is irregularity, if the female forgets to take the pill on even a particular day, then she may conceive. There are chances of failure if she does not take the pill regularly. So, like I said, these oral pills may have progestogen alone or they may be combinations of progesterone and estrogen. Okay? Generally, there are two types of pill. First one that we are going to talk about are called the daily pill. So, the first 2 points that we are going to discuss here is about the daily pill, and the third one is once a week pill. So two types of pill that is mentioned in the NCRT. One is referred to as the daily pill that needs to be taken every single day. For how long? For a period of 21 days. Starting within the first 5 days of her menstrual cycle. So she is experiencing bleeding or menstruation during the first 5 days. From that time onwards, that is during the last stage of her menstruation, while she is bleeding, she has to start consuming the pill. And this pill needs to be taken for a period of how many days? For a period of 21 days. Why 21 days? Why not the entire month? She has to give a gap of 7 days. Because what happens in the case of daily pill is that, imagine a daily pill is a combined pill. It contains progestogen plus estrogen. And you all have learnt in the menstrual cycle, whenever there is progestogen and estrogen in the blood, now what do these lead to? These cause the thickening of the uterine lining. The uterus becomes very, very thick. Which layer of the uterus? The innermost layer of the uterus, which is called endometrium. Now, if she does not stop taking the pill, even after 21 days, then after 21 days, her endometrium has become very thick. And if she does not take a break, there are chances that the endometrium breaks down spontaneously and there is excessive blood loss. It is called breakthrough bleeding. So that's why what she should do to prevent that breakthrough bleeding, after 21 days, when her endometrium has become very thick, she has to stop taking the pill for 7 days. That will prevent the further thickening of the endometrium, and that will allow normal bleeding or menstruation to take place. So during the 7 days she is experiencing bleeding or menstruation, because whatever endometrium had become thicker due to her taking the pill for 21 days will get back to its original thickness, and because it gets degenerated, it gets disintegrated, and it gets shed off in the form of bleeding or menstruation. Again, after 7 days of break, she has to repeat it for 21 days again in the next month, as long as she wants contraception. If she decides to bear a child, if she decides to conceive, she may stop taking the pill. Did you understand? So daily pill is taken for how long? For 21 days. How much of a break is given after that? 7 days break. Why should there be a break of 7 days? Because when the daily pill is being consumed, she is consuming a combination of progestogen and estrogen that causes thickening of the endometrium. By the end of the 21 days, the endometrium becomes very thick. To prevent further thickening, a break of 7 days needs to be given when she does not take a pill, which results in normal menstruation or bleeding. After that, the cycle is repeated again. What about once in a week pill? Saheli, we had discussed, by Central Drug Research Institute of Lucknow. It was a pill devised in India. It is a very safe pill which is containing a non-steroidal preparation. It does not have a steroid, because steroids are dangerous to the human body. They may have adverse effect on the human health. Correct? So Saheli is a once in a week pill. Now how come this is taken once in a week pill? Because Saheli is a mini pill. When I say mini pill, it is progestogen only. It is not a combination of progestogen and estrogen. When there is no combination of progestogen, estrogen, what will not thicken? The endometrium will not thicken. It will remain thin. That's why this doesn't have to be taken every day, and there's no need to give a break. It is taken once in a week. It's called once a week pill. So you got roughly the idea. I have not gotten into much details as to how Saheli, how long it should be taken. Okay, we are only going to stick to what is mentioned in the NCRT for the PU syllabus. You understood the difference between the daily pill and the combined pill. The daily pill is a mini pill. Sorry, the daily pill is a combined pill which is progestogen estrogen combination. How many days should it be taken? 21 days. After that, a gap of 7 days for menstruation. Why? Because by the end of 21 days, the endometrium has become very thick, because progestogen and estrogen are responsible for growth and maintenance of thickness of the endometrium. Saheli is a once a week pill. It is a non-steroidal preparation and it was devised by the Central Drug Research Institute of Lucknow. So now you understood the two types of pill, daily pill and once a week pill. Okay. So this is how a daily pill looks like, and this is Saheli, which is once a week pill. How do oral pills work? Another very important 1 or a 2 mark question in your board exam. Mechanism is very important. Oral pills inhibit ovulation. Remember, oral pills have hormone supplements. They have synthetic hormones, progestogen. These are not real hormones. Progestogen, estrogen, or progestogen only. These are synthetic hormones. What do these hormones do? They inhibit the release of egg, that is ovulation, and they also make the uterus unsuitable for implantation. Just like IUD, they also make the uterus unsuitable for implantation, and they do not allow the production of egg. Menstrual cycle and the follicle development is not there, and egg is also not produced. So imagine, if there is no ovulation, there is no question of conception, there is no question of fertilization or pregnancy. If there is no implantation, there is no question of pregnancy. They work by another method. They also alter the inner lining, the mucus covering of the inner wall of the cervix. And so they will either prevent or they will suppress or retard the movement of the sperm when they are crossing the cervix. The sperm find it very difficult to cross through the cervical mucus because it is altered by the oral pill, and so the sperm may get killed in the cervix itself. Obviously, if the sperm get killed in the cervix, they do not reach the uterus, they do not reach the fallopian tube, there is no question of fertilization. Okay? There is another type of oral pill or oral contraceptive pill which is called emergency contraceptive. Very important 2 mark question. Sometimes a couple has had unprotected coitus. They have not used any birth control option, any natural method or barrier method. There is a risk of the female conceiving or becoming pregnant. So if they have involved in unprotected sexual intercourse, within 72 hours of unprotected sexual intercourse, the woman may take a pill which is progestogen alone or progestogen estrogen combination, or there may be a very quick insertion of a hormone releasing IUD. There is a time window for this. If she feels that she may conceive because of unprotected coitus, within 72 hours she has to consume the pill, either mini pill or combined pill, that is progestogen alone or progestogen estrogen pill, or she has to get a hormone releasing IUD inserted into her uterus. What does all this do? We know how it works. Within 72 hours, if the sperm is still making its journey up the female reproductive tract, we saw how these pills and IUDs, they can alter the mucus, the environment in the cervix of the woman. Thus they may block or they retard the entry of the sperm. And we also saw how they alter the endometrium of the uterus. And we also saw, if she takes a pill, if by chance she has not ovulated, she has not produced an egg, then that is blocked. Ovulation is prevented. But what is the time window for this? Within 72 hours of unprotected coitus, this has to be done. And since this is done over a very short notice, that's why it is called emergency contraceptive. So in emergency contraceptive, there are 3 options: either a mini pill or a combined pill or a hormone releasing IUD. So how do these emergency contraceptives work? They block ovulation. Luckily, if she has not produced an egg, she will not produce now because she has taken one of these 3 measures. Okay, then They may also, another way it can work is, it can block implantation. It inhibits, the word to use here is inhibition actually. It inhibits implantation, and then it alters the cervical environment. If the sperm are still traveling, what do? They retard the sperm entry further into the female reproductive tract. The sperm may be traveling up the cervix now, but because of these pills, the cervical mucus will become altered, or the cervix will become dangerous to the sperm, and the sperm will get killed over there, so they don't enter the uterus. And that's why it blocks conception. Did you understand? So these are the mechanism of action of oral contraceptives, which are called emergency contraceptives, which is consumed 72 hours of within 72 hours of unprotected coitus. Injectable and implants are also coming under pharmacological methods because they also release chemicals. They are mostly found to be containing progestogen alone. Okay, but they've also mentioned that it may be in combination with estrogen. If it is an injection, mostly it is in a combination of estrogen, but if it is an implant, it is mostly progesterone alone. Progestogen is synthetic progesterone. Now see implants. See how these matchstick sized implants are there. 6 matchstick sized capsules, and they are surgically implanted. A small incision is made in the skin, in the upper arm, above the elbow, on the inner side of the upper arm. And there these 6 matchstick sized capsules are implanted underneath the skin, and the incision is sutured. They are very, very long lasting. Once it is implanted under the skin, there is no need for the female to remember. Like in case of oral pill, every day she has to remember to take the pill, otherwise the chances of failure are high. This is advantageous that way, because once it is put in place, there is no need to consume any pill. She doesn't have to remember to take the pill or anything of that sort, and its effective period is much, much longer. For weeks and months together, the female doesn't have to worry about conception. If she wants to conceive, she can get these removed by the doctor, and once again her regular reproductive cycle, she can resume her regular reproductive cycle. So these are not orally administered, as you saw. These are implanted underneath the skin. Sometimes injections are also given intradermally within the skin, underneath the skin, or into the muscle. Intramuscular injections are given, which also slowly release the hormone into the blood, and they prevent ovulation, they prevent implantation. Okay, but mostly implants are the ones which are very, very long lasting. They have long effective periods, prolonged effective periods. The next type of chemical method or pharmacological method is use of spermicide. A chemical which kills the sperm is called a spermicide. So there are creams, there are jellies, there are foams. Foams are nothing but substances or suppository which gradually dissolve. They are placed in the vagina, they gradually dissolve, and they release a chemical which will kill the sperm when the sperm are liberated into the vagina. Such substances which slowly dissolve inside the body when it is placed in position are called foams. So like I said, spermicidals are sperm killing chemicals. Ultimate goal here is to prevent fertilization. So they kill the sperm, and they are introduced into the vagina just before sexual intercourse or coitus. Sometimes they are used with barriers like diaphragm, cervical caps, and vaults. The jelly or the cream is smeared onto this dome shaped rubber that we saw in cervical cap and diaphragm, and that is inserted into the vagina. So it improves the efficiency of the barrier methods, because not only is the barrier method blocking the entry of the sperm into the cervix, but it is also smeared with the cream and jelly, and as a result, when the sperm comes in contact with them, the sperm get killed. Such chemicals which are poisonous to the sperm are called spermicidal creams and jellies and foams, or simply they are called a spermicide. Okay, so that completes the major types of family planning or birth control methods. What are they? Surgical methods include, first one we discussed was natural methods in the previous lecture. In this method we discussed about barrier methods. Then we discussed about intrauterine devices, and then we discussed about the pharmacological methods. But now we are discussing about surgical methods, the last method, and this is called a terminal method. Terminal means it is permanent. Okay, terminal methods of contraception. They are also called sterilization. They are surgically conducted. They need surgical intervention. That's why they are called surgical methods. It blocks gamete transport. The gametes are not allowed to move. They block the transport of the gamete, and therefore they prevent conception or fertilization. Now when I show you the picture or the diagram and explain, you will understand how it works. There is two procedures separately in male and female. In male the procedure is called vasectomy. In female the procedure is called tubectomy. So vasectomy is a procedure, it's specific to male. And here a small part of vas deferens is removed, or it is cut and tied by making a small cut in the scrotum. So the doctor makes a small incision in the scrotum. He pulls out the vas deferens. He either removes the vas deferens entirely or it is tied up. You can imagine what will happen if the vas deferens is cut. The sperm is not transferred up into the ejaculatory duct. The male during sexual intercourse will release the semen, but the semen will not have the sperm. So we should not call it semen, we should call it seminal plasma. Only the seminal plasma is released into the female. There is no sperm in it. Why? Because what have you cut? What have you blocked? Vas deferens. So the production of the sperm continues, but the sperm are not reaching the urethra. There is no question of the sperm being released into the body of the female during coitus. In female, it is called tubectomy. You can imagine a small part of the fallopian tube is removed, or it is tied up by making a small incision in the abdomen. So imagine if the fallopian tube is tied. The ovum is sitting on the other end of the fallopian tube, and the sperm has to cross the fallopian tube to reach the other end. But you have removed the fallopian tube, a portion of it, or you have tied it up. So the sperm cannot reach the egg which is sitting in the ampulla. So obviously if the sperm cannot reach the egg, there is no question of fertilization. See here how the vas deferens is cut and tied over here. So the sperm gets trapped over here, it cannot move up. And see how the fallopian tube is cut and tied. So the egg is sitting here in the ampulla, but the sperm cannot reach the ampulla because you have cut and tied the fallopian tube. This process in male is called vasectomy. In female it is called tubectomy. Did you understand? So you are blocking the transport of sperm in vasectomy, and in females you are not, again you are blocking the transport of the sperm because the sperm reaches all the way up into the uterus, and here it gets blocked. There is no path for it to move ahead and reach the egg which is sitting somewhere in the ampulla of the fallopian tube. So obviously fertilization will not happen, and here the sperm cannot reach the urethra. It cannot reach the ejaculatory duct and the urethra. So during coitus, only the seminal plasma is released. There is no sperm in it. So like I said, they require surgical intervention. And why are they called terminal methods? Because they are permanent. And there is a major disadvantage to this. The disadvantage is it is having poor reversibility. It is not like a couple who get it done, they change their mind that they want to bear children and they go for a reversible surgery. Reversibility is reported, but reversibility is very, very poor. But the advantage is it is highly effective. Couple who have born enough kids and they decide that they don't want to bear any more children for the rest of their reproductive life, only they can go for surgical methods because it is 100% effective. But those couple who are unsure, if they get it done and if they want to bear children again, then there is a disadvantage that the reversibility is poor, because if the cut part is joined again after untying it, it may work or may not work. That's why it is referred to as terminal methods of contraception. So usually a 1 mark question: what is the disadvantage of terminal or surgical methods of contraception? The disadvantage is that it has poor reversibility. It is very important to note that contraception, especially contraceptives which involve chemicals and certain devices, must be undertaken only by consulting an expert or a specialist, medical professional. Of course, if it is a natural method, then the couple can do it, practice it on their own. And please don't be under the impression that it is very, very necessary to follow contraception for maintenance of reproductive health. No, it is not a prerequisite. It's not a regular requirement for reproductive health. Then why do a couple opt for contraceptive? They usually opt for contraceptive, say for example, if they don't want to become pregnant for some personal reasons, or they've had a child, they want to have a next child after a certain gap. They want to space their pregnancy. So it is purely for personal reasons. It is not a prerequisite or a regular requirement for maintenance of reproduction. Of course, if there is an exception to this, I told you the use of condom can reduce exposure to sexually transmitted illnesses. When it comes to such methods like condom, yes, of course, it is a requirement for maintenance of reproductive health. Okay? Suppose a couple is using contraceptive unscrupulously, without any guidance and without any supervision, and erratically for a very, very long period of time, then it can prove to be very harmful, especially chemical methods. The female is consuming pills, oral pills, once in a week pills, without taking consultation on her own. Then the person may suffer from certain complications or ill effects or side effects. Very important 2 mark question: what are the ill effects of long term use of contraceptives, especially unsupervised, unscrupulous use? It can cause nausea, abdominal pain, breakthrough bleeding, sudden bleeding with excessive blood loss, irregular menstrual bleeding. The menstrual cycle may become highly irregular. Even though a very few cases have been reported, but something we should not ignore are cases of breast cancer associated with probably chemical and hormonal, because you're using synthetic hormones, and hormones have a way of altering the physiology of the body, and they can lead to cancers like breast cancer. Okay, so these are the possible side effects or ill effects of using contraceptives unscrupulously or prolonged use of contraceptives. Moving on to, so that completes the concept of contraceptive, all the major types. Remember, they can also ask a 5 marker question about contraceptives because there are so many varied types. Next, let us move on to MTP. The full form of MTP is medical termination of pregnancy. As the name indicates, pregnancy is put to end without or before attaining full term. So intentional or voluntary termination, that is, the parents themselves want to put an end to pregnancy. They want to discontinue the pregnancy. This is also, in common lay terms, you can also call it abortion or induced abortion. So MTP stands for medically terminating pregnancy. The government of India has legalized medical termination of pregnancy way back in 1971, but with certain strict rules, because of course MTP also can be misused. isn't it? But remember, it is intentional and voluntary. The couple are very much aware of the fact that yes, they do not want to continue with the pregnancy. Okay? Why do couples opt for MTP? A very important 2 mark question. What is the need to legalize MTP? Why should MTP be legalized? Is another way of asking the same question. Very important. Remember, why should MTP be legalized, or why should couple opt for MTP? Obviously, to get rid of unwanted pregnancies. Now they take an educated decision, couple, isn't it? They're adults, they can decide for their own life. So if they feel that their pregnancy is unwanted for personal reasons, they can get rid of such unwanted pregnancies. Either due to casual unprotected intercourse, they did not use any birth control method during their sexual intercourse or coitus, or they did use a contraceptive but it failed. So why would they want to terminate the pregnancy? Because the pregnancy is unwanted. How did such an unwanted pregnancy come about? Because of casual unprotected intercourse or because of failure of contraceptive. In certain cases, the mother is pregnant, the mother very much wants to continue the pregnancy, but there is some medical complication, and continuing the pregnancy could be harmful or even dangerous to the life of the mother or the fetus or both. Say the doctor has scanned the fetus and the doctor decides, or the mother is experiencing lot of health difficulties while she is pregnant, then the doctor would advise to the mother that you will have to terminate the pregnancy, otherwise it would be danger to the child or it would even be fatal to the life of the mother itself. So this is of course a very reasonable reason, or a reasonable you can say as to why couple would go for MTP. It's quite reasonable. Yes, it is putting the mother's life at risk or the fetus's life at risk, or it would give birth to a fetus which is having an abnormality and which would suffer for the rest of its life. So two major reasons, please remember, as to what is the necessity to legalize MTP, or why would couple opt for MTP. When is MTP safe, or during which time of pregnancy is medical termination of pregnancy safe? It is safe during the first 3 months of pregnancy, that is 12 weeks, or the first trimester of pregnancy. It is done up to the 5th month sometimes, but generally you should remember the most safest period is the first trimester, the first 3 months of pregnancy. This is also a 1 mark question. When is it considered safe for a person, for a woman to undergo medical termination of pregnancy? Now, what is the misuse of MTP? Why we should be bothered about it? I told you the government has made it legal, but with a lot of rules and regulations. That is because there are so many unqualified quacks who call themselves doctors with fake certificates who are performing MTP illegally. It is so dangerous because it is putting the mother's and the child's life to risk. Of course, the child is getting killed, but the mother's life is also at risk because the mother is not safe in the hands of such unqualified quacks. Sometimes in our country, they are misusing amniocentesis. They perform amniocentesis once the parents get to know that they have a female developing inside, the fetus is a female, then they decide to carry out MTP. If they identify that the fetus is a female, they kill the fetus. This is called female feticide, which is something totally illegal, immoral, unethical, isn't it? Just because the sex of the fetus is female, in today's society where female and male have equal importance, equal value, equal significance, this is completely illegal. Of course, in olden time there was no awareness among people. There was a lot of discrimination between the sexes, but now it is changed. So these are the two reasons, or these are the two means how MTP is misused, and that's why stringent rules, laws and regulations need to be put in place. Just making it legal is not important. but laying down stringent laws and regulations is very, very important. So remember, it is performed illegally by unqualified doctors or so-called doctors or quacks, putting the life of women in risk. And they also consume a lot of money, isn't it? They make a lot of money with this. And they misuse amniocentesis, and once they know it is a female fetus, they want to get rid of the fetus. That is female feticide. So what did we learn in today's class? We learned about the varied methods of contraception. In the previous lecture, we learned natural methods. In today's lecture, we learned barrier methods. We learned mechanical devices like intrauterine devices. We learned about chemical methods of pharmacological interventions. We learned about terminal methods or surgical methods like vasectomy in male and tubectomy in female. Remember, surgical methods are called terminal methods because their reversibility is poor. And what do? They block the transport of sperm, that is the gamete transport. And then we learnt about intentional or voluntary termination of pregnancy called MTP. Full form of MTP is medical termination of pregnancy. With that, we shall now look into the homework. State the principle of barrier methods. 3 types of IUD along with examples for a 3 mark. What is the working principle of hormone releasing IUD for 1 mark? What is the chemical composition of oral pill and what is the mechanism of action of oral pill? 3 marks. Write a short note on emergency contraceptive for 2 marks. Name the terminal method, surgical method, sterilization method in male and female. What is the disadvantage of surgical method? What are the side effects or the ill effects of overuse or unscrupulous use of contraceptive? Expand MTP, and what does MTP, when does MTP become essential, or why is MTP legalized in our country? There is a reason why it is essential. For 3 marks. In which year did Indian government legalize MTP and which period of pregnancy is considered safe for medical termination of pregnancy? MTP. Okay, so with this I conclude this lecture. So until next time, all of you take care. Thank you.